Let me see if your hands are good ones. And if they are, I'll even get pregnant for you." These were the words Jessica, a white joy, blurted out to a Japanese resident. The staff around them burst into laughter at this shocking statement made in the middle of the emergency room, while the person in question, Kenji Kimura, could only bow his head deeper. However, just 30 minutes later, that arrogant joy would be saying with a trembling voice, You, how do you have such skills?" The entire emergency room was shocked by the incredible skills shown by the man who appeared to be an ordinary Japanese resident. What could have happened? If you're curious about this story that's causing a stir in the American mom community, please hit the subscribe button and leave a comment saying, "Japanese medicine is the best. St. Mary's American Center in Manhattan, New York." It was the emergency medicine department of one of the best hospitals in the year. It was 7 a.m., the start of the shift change. A man walked down the hallway where medical professionals in white gowns bustled about, trying to be as inconspicuous as possible. He was Kenji Kimura, an East Asian man of average build, 175 centimeters tall, wearing black-rimmed glasses. He was a 28-year-old Japanese resident. His gown was more wrinkled than others, and his shoes looked as if they had been worn for years. When he arrived on time, other residents had already gathered to prepare for the morning briefing. Except for Kenji, everyone else was white. As Kenji quietly stood at the back, a few people glanced at him. He knew they were talking about him, but he showed no reaction. He just stared at the chart. With the clacking sound of high heels, Jessica White appeared. She was a 35-year-old chief resident. With her blonde hair neatly tied back, she held considerable power here. Above all, she was the daughter of the hospital's director. Jessica's uniform was crisply ironed, a thin gold necklace around her neck, and diamond earrings sparkling in her ears. Everything about her proclaimed how special she was. As Jessica entered, the atmosphere changed dramatically. At that moment, her gaze fell on Kenji, who was standing in the corner, the corners of her mouth slightly turned up. "Oh, our quiet Japanese friend is here too." She emphasized the word Japanese with a deliberate pronunciation, as if it were a word implying something inferior. The surrounding residents covered their mouths to suppress their laughter. Kimura, was it? Japanese names are too difficult to pronounce, so I can never remember them. Kenji replied in a small voice, "It's Kenji Kimura." "Oh, right, Kenji. But your English is still quite unnatural. I worry if you can properly communicate with patients, especially in emergencies. You know that misunderstanding even a single word can lead to death, right?" In reality, Kenji's English proficiency was not a problem at all. In fact, he used more accurate medical terminology than most American residents. However, he was usually taciturn, and Jessica saw this as a weakness. Besides, Kenji, you Japanese people value seniority, don't you? This is America. Just bowing your head to your superiors without complaint will make patients anxious. As the briefing began, reports on their respective patients followed. Other residents presented confidently, interjecting jokes to lighten the mood. But when it was Kenji's turn, the atmosphere clearly changed. He reported on his patient concisely and precisely. From diagnosis to treatment, it was flawless. However, Jessica still tried to find fault. "It seems you have a decent grasp of the patient's condition, but you still don't seem to have fully adapted to the American medical system. It's quite different from Japan, isn't it? Isn't it still quite backward there?" This was a blatant insult, but Kenji simply replied, "Yes, I will try harder." This kind of thing was repeated almost daily. During lunch, Kenji ate his bento box alone in a corner, but Jessica even made an issue of this. "The smell really ruins my appetite. This is is a hospital, and there are patients. I'd appreciate it if you'd refrain from eating such strongly smelling food. Kenji silently put away his bento box and moved to a small park behind the hospital. Even while eating his cold rice on a cold bench, he didn't complain. What was even harder to endure were the incidents that happened in front of patients. When a white patient came in, Jessica became even more overt. "Don't worry, there are skilled American doctors here. I'll be in charge directly, not this Japanese student." Kenji was a formal resident, not a student, but Jessica intentionally referred to him condescendingly. The patients nodded with relief, and Kenji stepped back, playing only a supporting role. One day, he received even more direct insults. "Are all Japanese men that small? America helped you win the war, so what right do you have to be so proud?" Every time he heard such words, Kenji's fists clenched naturally. Something hot welled up from deep within his chest, but he suppressed it. Without changing his expression, he continued to do his work. One Thursday afternoon, in a rather bustling emergency room, Jessica was chatting with the nurses. As Kenji, who was organizing charts, walked by, a mischievous glint appeared in Jessica's eyes. "Hey, everyone, let's say something funny to our quiet Japanese friend, shall we?" As the nurses showed interest with laughter, Jessica approached Kenji. "Kenji, your hands seem delicate, but..." Faced with the sudden words, Kenji looked up, and Jessica offered a sarcastic smile. "But I'm really curious. Are you Japanese men really like the rumors say?" The surrounding nurses started to giggle. Kenji felt an unpleasant premonition, but he said nothing. Jessica became more explicit. "I'll admit your skills as a doctor, but what about as a man? Let me see if your hands are good ones, and if they are, I'll even get pregnant for you." For a moment, the emergency room fell silent. This was blatant sexual harassment and a racist remark. Some nurses were taken aback, but no one intervened. Jessica was the chief resident and the director's daughter. Kenji's face turned red again. Shame and anger rushed in at him simultaneously. His hands clenched the chart tightly, and his jaw muscles visibly stiffened, but he still said nothing. "Oh, your face is red. Are you embarrassed or angry? But honestly, tell me, are you really confident?" The surrounding laughter pierced Kenji's ears. At that moment, all sorts of thoughts flashed through his mind like lightning. All the humiliation he had endured rushed back, and a burning anger welled up within him. But Kenji remained silent. Leaving only a "sorry," he quietly walked away. As expected, all Japanese men are like that. Boring. Can't even talk back. That night, Kenji went up to the hospital roof alone. The New York night view from the 11th floor was beautiful, but his heart was far from peaceful. The cold wind caressed his face, and complex emotions welled up in his eyes. There was anger, frustration, and above all, deep sadness. But at the same time, there was a reason he could not give up. Kenji took out a worn-out photo from his pocket. In the photo was a young woman smiling brightly. "Just wait a little longer," he murmured to himself. It wasn't time yet. For reasons only he knew, he had to endure more, but fate did not intend for him to wait any longer. The very next day, an incident that would completely turn everything upside down would occur. Friday, 11 a.m. It was a time when fate would change for Kenji, though he didn't know it yet. He was calmly handling his morning duties, organizing charts as usual. The emergency room was unusually busy today. 2 traffic accident patients came in since dawn, a man in his 60s who had a heart attack, and a homeless man who had lost consciousness due to alcohol poisoning. The situation was overwhelming. Nurses ran around frantically, and residents were busy with their respective patients. Kenji was checking on Miss Suzuki, a patient he had been attending to since last night. The woman, a Japanese American in her 70s, had visited the emergency room complaining of severe abdominal pain. Other residents had performed initial examinations, but found nothing particularly abnormal, and she was being monitored. The old woman's face lit up when she saw Kenji. "Oh my, isn't that our young Japanese doctor? It's comforting to see a face from my own country." Kenji smiled faintly and carefully examined the old woman's condition. As he palpated her abdomen again, he felt something strange. There was a subtle change that the other residents had missed. He reviewed the blood test results again in detail. Her white blood cell count was gradually increasing. It was within the normal range at first, but now it was on the verge of becoming critical. Kenji's gaze became serious. He began to question the old woman more thoroughly. "Ma'am, when did the pain start? Please try to remember exactly." "Let me see. It's been about 3 days since my stomach started feeling a little bad, and yesterday it hurt so much I couldn't stand it." Kenji nodded and palpated her abdomen again. This time, he did it more meticulously, not missing even the slightest change in the old woman's expression. When he pressed her lower right abdomen, he didn't miss her wince. Various possibilities quickly flashed through Kenji's mind. He determined that further tests were necessary, but at that moment, Jessica appeared. "What are you doing?" Kenji said cautiously. "I'm re-examining Ms. Suzuki's condition. Perhaps there's a possibility of appendicitis, so how about a CT scan?" Jessica made a look of exasperation. "CT scan?" Michael examined her and said there was nothing wrong. "Aren't you worrying unnecessarily? Are you planning to cause a medical expense explosion?" But her white blood cell count keeps rising, and so does the abdominal pain. In Japan, do you give every patient a CT scan? This is America. There's the issue of cost-effectiveness. What will you do if I arbitrarily order tests and the insurance company raises an issue? The surrounding nurses nodded at Jessica's words. They also thought Kenji was being a bit overly sensitive. Kenji could say nothing more. He was still just a first-year resident, and Jessica was the chief. "Let's give her some more painkillers and observe her. If there are any claims for unnecessarily expensive tests, you'll be responsible." Kenji reluctantly nodded. However, a nagging doubt lingered in the back of his mind. His medical intuition warned him that he was missing something. Around 2 p.m., Kenji went to check on Ms. Suzuki again. As per Jessica's instructions, the old woman's pain seemed to have subsided slightly after being given painkillers, but something still seemed wrong to Kenji. "Ma'am, how are you feeling?" "It still hurts a little, but it's better than before." Kenji palpated her abdomen again. The pain had lessened due to the painkillers, but her abdominal rigidity remained, and her body temperature seemed to be slightly elevated. At that moment, Michael walked by and teased Kenji. "Still stuck on that old lady? Jessica told you to observe her. Don't overreact." Kenji just nodded without saying anything, but the unease continued in his heart. He remembered seeing a similar case in Japan. Symptoms of appendicitis in elderly patients can be vague, and if mishandled, it could lead to peritonitis. Around 4 p.m., Kenji was attending to another patient when suddenly a commotion broke out in a corner of the emergency room. A nurse cried out in an urgent voice, "This patient's condition is strange." Kenji rushed over and saw it was Ms. Suzuki. The old woman's face was pale, and she was sweating profusely. Her blood pressure had dropped, and her pulse was rapid. "Ma'am, ma'am." But the old woman was semi-conscious. His heart pounded. The worst-case scenario he had predicted was happening. Jessica rushed over. "What is it? How did she suddenly get like this?" "It seems her appendicitis has ruptured. It's progressing to peritonitis. "We need to get her to the operating room immediately," Kenji said with urgency, but Jessica seemed unable to hide her distress. She didn't have much experience diagnosing appendicitis, especially in elderly patients. "That can't be. Let's just do another blood test first." "There's no time. We need to get a CT scan now and prepare for surgery." Kenji's voice was filled with urgency, but Jessica still hesitated. She didn't want to admit that her missed diagnosis had put the patient in danger. "Are you ordering me around now? Who do you think you are to talk to me like that?" At that moment, the old woman's condition worsened further. Her blood pressure dropped sharply, and her pulse began to weaken. Kenji couldn't wait any longer. Before he even realized it, he pushed Jessica aside and rushed to the old woman. He began to instruct the nurses. "Start an immediate IV infusion of normal saline and prepare blood pressure medication, and check if the operating room is available for emergency surgery." The nurses instinctively followed Kenji's firm instructions. Everyone was surprised by Kenji's demeanor, so different from his usual quiet self. Jessica yelled, "What are you doing now? I'm the chief, the chief." But Kenji ignored Jessica's words and continued to attend to the old woman. His hands were precise, and his judgment was swift. He seemed like a different person altogether. "Can we get a CT scan immediately?" The radiologist nodded. "It's possible right away." "All right, ma'am. You'll be okay. I'm here, so don't worry." There was an inexplicable confidence in Kenji's voice. It was as if he had experienced such situations countless times. Although semi-conscious, the old woman tightly gripped Kenji's hand. The CT scan results came out. As expected, her appendicitis had ruptured and peritonitis had begun. His diagnosis was correct. Jessica's face turned pale. The patient was in life-threatening danger due to her missed diagnosis. But she still didn't want to admit it. This was unpredictable. Elderly patients have vague symptoms, but... However, the eyes of the other medical staff watching began to change. Everyone knew that Kenji had made the correct diagnosis from the beginning. As the old woman was escorted to the operating room, Kenji let out a deep sigh of relief. Fortunately, it wasn't too late, and the surgery was expected to be successful. But if it had been any later, it would have been truly dangerous. Nurse Emily quietly approached Kenji. "Kenji, that was truly amazing. If it weren't for you, I don't know what would have happened to the old woman." Kenji shook his head. "I just did what I was supposed to do." But Emily continued, "No, it was truly amazing. How could you diagnose it so accurately? You looked like a doctor with extensive experience." Kenji didn't answer. Instead, he seemed lost in deep thought, gazing out the window. Through today's events, his true abilities were beginning to be revealed. But he still had to be more cautious. Jessica was flustered under the gaze of the other residents and nurses. The fact that her mistake was exposed, and moreover, that the Japanese resident she had looked down on had saved a patient, hurt her pride. At 6 p.m., news arrived that the old woman's surgery had been successful. The chief of surgery himself came down to the emergency room and looked for Kenji. "Are you resident Kimura? That was a wonderful diagnosis. It would have been really dangerous if it had been any later." Jessica's chief's praise made the atmosphere in the emergency room strange. All eyes were focused on Kenji, and Jessica's face turned red. Kenji replied calmly. Fortunately, it wasn't too late. However, complex emotions swirled within him. Through today's events, his hidden abilities were beginning to be revealed. It was only the tip of the iceberg, but it was undoubtedly the beginning of a change. Around 8 p.m., Kenji sat alone in the hospital cafeteria. The day had felt very long. At that moment, Michael approached and sat down. "Kenji, was surprised. Were you really just a resident in Japan? There's something different about you. Kenji's gaze flickered for a moment, but soon he returned to his usual quiet expression. It was just luck. Michael tilted his head, but he didn't ask any further questions. However, he clearly seemed suspicious. That night, Kenji went up to the hospital roof again. He knew that his true identity was gradually being revealed through today's events. He could no longer completely hide. He took out the photo from his pocket again. The woman in the photo was still smiling brightly. Sorry, it might be a little sooner than expected. The wind blew, rustling his hair. Everything will probably change starting tomorrow. Today's events would mark the beginning of his true story. Monday morning, the atmosphere in the hospital had subtly changed. Since last Friday's incident with Miss Suzuki, people's gazes towards Kenji were clearly different. As nurses passed Kenji in the hallway, they greeted him more politely, and some residents glanced at him with expressions of curiosity. However, Jessica's attitude had become even colder. Her mistake had been clearly exposed, and the fact that the Japanese resident she had looked down upon had embarrassed her, hurt her pride. Every time Kenji passed by, she deliberately averted her gaze, and during the morning briefing, her attacks on him became even more overt. Resident Kimura, you were just lucky on Friday, but medicine isn't about luck. It requires logical thinking and experience. Jessica deliberately said this in front of other residents. She tried to belittle Kenji's accurate diagnosis as mere chance. Kenji still said nothing. He just nodded lightly. But there was something different in his eyes. It was as if something that had been dormant deep within him was slowly awakening. Tuesday afternoon, another incident occurred in the emergency room. A white man in his 50s was brought in, clutching his chest. It was a typical myocardial infarction symptom, and Michael was assigned as the temporary attending physician. However, Michael, lacking experience, made a mistake in the initial response. He misinterpreted the electrocardiogram. He missed the ST segment elevation and diagnosed it as simple angina. He administered only nitroglycerin to the patient and suggested observing him. But the moment Kenji looked at the EKG, his expression stiffened. It was a myocardial infarction. Immediate revascularization was necessary. Calculations quickly raced through Kenji's mind. This patient's heart muscle is dying this very moment. Kenji cautiously approached Michael. If you don't mind, can I take another look at the EKG? Michael replied with annoyance. What do you want to look at again? It's just angina. Just give him nitro and observe him. But Kenji didn't give up. It was a matter of the patient's life. He looked at the EKG again in detail. Clear ST elevation was visible in leads V2 and V3. It was clearly a transmural myocardial infarction. Michael, this looks like a myocardial infarction. I think we should get him to the cardiovascular center immediately. Michael reacted irritably. Hey, who do you think you are, telling me my diagnosis? I can read EKGs too. At that moment, the patient's condition deteriorated rapidly. He suddenly lost consciousness and collapsed. It seemed like cardiac arrest was beginning. Kenji acted instinctively. He immediately rushed to the patient and began cardiopulmonary resuscitation. His hands were precise, and the depth and speed of compressions were perfect. It was as if he had done it thousands of times. Prepare the defibrillator and 1 gigacourse of epinephrine, Kenji instructed the nurses. His voice was confident and authoritative. They automatically followed his instructions. After delivering the electric shock, the patient's heart rhythm returned. Kenji immediately contacted the cardiovascular center. He instructed them to prepare for emergency revascularization. The entire process flowed like water. The medical staff watching were all stunned. They could never have imagined Kenji, so quiet, handling an emergency situation so skillfully. Especially his CPR skills were at an expert level. Jessica arrived late and grasped the situation. "What happened?" Michael replied, flustered. The patient suddenly collapsed, and Kenji provided first aid. Jessica's face contorted. Once again, Kenji had stepped in at a critical moment and saved a patient. Moreover, it was in a way that compensated for Michael's mistake. After the patient was transferred to the cardiovascular center, the atmosphere in the emergency room became palpable. Everyone was looking at Kenji anew. The skills of an ordinary first-year resident were beyond common sense comprehension. Nurse Emily quietly said to Kenji, "Kenji, that was truly amazing. How can you perform CPR so perfectly? You looked like a professional." Kenji replied calmly, "I just studied hard in school." But Emily shook her head. "No, it's not like that. Your hands, your judgment, everything was like an experienced doctor. Were you really just a resident in Japan?" Before Kenji could answer, Jessica interrupted. "Emily, don't over-evaluate him. He just followed textbook procedures. It's not a big deal." However, the gazes of those around him had definitely changed. This was the second time. It was too accurate and skillful to be a coincidence. Something unfortunate happened. A pregnant woman in her 30s was brought to the emergency room. She had started bleeding suddenly at 36 weeks of pregnancy. The obstetrician would be here soon, but emergency room intervention was necessary for the time being. Jessica took charge, but she lacked experience in obstetric emergencies. While observing the patient's condition, she couldn't make an accurate diagnosis. Was it placenta previa, placental abruption, or some other cause? Kenji watched the patient from the side. The moment he saw the patient's abdomen, his gaze sharpened. Judging from the shape and rigidity of the uterus, the bleeding, and the overall symptoms, placental abruption was suspected. It was an extremely dangerous situation. Placental abruption is an emergency for both the mother and the fetus. It was a situation where an emergency cesarean section might be needed immediately. But Jessica still hesitated. Kenji cautiously approached. "Did you consider the possibility of placental abruption?" Jessica reacted sharply. "I'm an obstetrician, so don't make diagnoses on your own." But at that moment, the patient's condition worsened further. The bleeding increased rapidly, and her blood pressure began to drop. The fetal heart rate also became unstable. It was a truly urgent situation. Kenji could no longer stand it. It was a matter of the patient's life. He pushed Jessica aside and approached the patient directly. "Nurses, call the obstetrics resident immediately and request preparation for an emergency cesarean section in the operating room. Also, prepare for a blood transfusion." Kenji's instructions were precise and swift. The nurses began to move according to his instructions. Jessica tried to protest, but the situation was too urgent. Kenji took all necessary measures to stabilize the patient. Continuous oxygen administration and monitoring were perfect. It was as if an obstetrician were performing the procedures. 10 minutes later, the obstetrics resident arrived. Upon grasping the situation, he immediately ordered the patient's transfer to the operating room. He praised Kenji's diagnosis and initial treatment as perfect. Who performed the initial response? That was truly wonderful. If it had been any later, it would have been truly dangerous. All eyes were focused on Kenji. This was the third time. It could no longer be attributed to coincidence. The skills shown by an ordinary first-year resident clearly exceeded the usual level. Jessica's face turned pale. It was a repeated situation where Kenji compensated for her mistakes. This could no longer be dismissed as coincidence. Rumors about Kenji began to spread among the residents. Kenji is strange. His skills are too amazing. Was he really just a resident in Japan? Michael directly approached Kenji and asked, "Kenji, honestly, tell me, were you really just a resident in Japan? You seem to have a lot of experience." Kenji hesitated for a moment. It seemed he could no longer completely hide it, but it wasn't time to reveal everything yet. "I just had a little more experience in Japan." It was an ambiguous answer, but Michael sensed that there was a bigger secret. However, he didn't ask any further questions. That night, Jessica visited the office of the director, Dr. Thompson. She felt she couldn't leave Kenji alone any longer. She felt threatened in her position. "Uncle, about resident Kenji Kimura, something is strange. His skills are too amazing. It's suspicious. Perhaps he's exaggerating his background." Dr. Thompson showed interest. "Strange. Recently, he's been handling difficult cases perfectly, one after another. It's not at the level a first-year resident can achieve. Perhaps his background is fabricated." Dr. Thompson pondered for a while. He had indeed heard good rumors about Kenji recently. He had heard praise from the chief of surgery, and that he had a good reputation among the nurses. "All right, let's verify at once." Jessica smiled with satisfaction. She thought this would reveal Kenji's background no matter what it was. And if there was any problem, she expected to be able to get Kenji kicked out of the hospital. But she hadn't anticipated what would happen. She didn't know how amazing Kenji's true identity was, and that everything would soon be revealed. Friday morning, an important meeting was underway in Dr. Thompson's office. Based on Jessica's request, the results of investigating Kenji's background were presented. However, the results were completely different from what Jessica had expected. Upon re-examining Kenji Kimura's documents, everything is normal. Graduated from the University of Tokyo's Faculty of Medicine with excellent grades. His letters of recommendation are also perfect. There seem to be no particular issues, Dr. Thompson said, flipping through the documents. Jessica was bewildered. She was convinced there had to be something strange, yet there were no issues on paper, but she couldn't give up. "But Uncle, when you actually see him, he's really strange. He's performing at a level that a first-year resident shouldn't be able to." Dr. Thompson pondered for a while. He himself had recently heard rumors about Kenji. He had heard praise from the chief of surgery, and that he had a good reputation among the nurses. In that case, it would be best to confirm it directly. If a particularly difficult case comes in today, let's deploy Kenji Kimura and test his skills. Jessica inwardly rejoiced. She thought she finally had a chance to expose Kenji's true identity. She was confident that his true nature would be revealed in front of a difficult case, no matter how much he tried to hide his skills. At 2 p.m., a shocking situation occurred in the emergency room. Due to a large-scale traffic accident, 6 severely injured patients were brought in at once. It was a collision involving a truck and 3 passenger cars, and all patients were in critical condition. The emergency room instantly turned into a battlefield. Medical staff divided the patients and began first aid. Jessica intentionally assigned the most severely injured patient to Kenji. It was a man in his 40s who was unconscious due to multiple injuries. The patient had sustained injuries to his head, chest, and abdomen. It was a complex situation where it was unclear where to start. This type of case was difficult, even for experienced specialists. Jessica expected Kenji to be flustered, but his reaction was completely different. The moment he saw the patient, he calmly began to assess the situation. Kenji's gaze changed. His usual quiet and timid demeanor was nowhere to be found. Instead, with sharp, focused eyes, he quickly scanned the patient's condition. His hands naturally checked the patient's carotid artery simultaneously assessing his respiratory status and level of consciousness. Let's start with a rapid survey. Secure the airway and check oxygenation, Kenji instructed the nurses. His voice was full of confidence and without any hesitation. The patient's breathing was unstable. There was a high possibility of pneumothorax. Kenji immediately ordered a chest x-ray while simultaneously checking his lungs with a stethoscope. His right lung sounds were significantly diminished. It was tension pneumothorax. We need to insert a chest tube immediately. Prepare it. At Kenji's instruction, the nurses moved quickly, but Jessica intervened. Wait, what are you trying to do? Chest tube insertion is too dangerous. Call surgery. There's no time. Kenji said firmly. His blood pressure is dropping rapidly. His heart is being compressed due to the tension pneumothorax. Kenji could no longer wait. He quickly disinfected the chest tube insertion site and administered local anesthesia. His hands were precise and natural, as if he had done it hundreds of times. He incised the skin with a scalpel and punctured the muscle layer with a trocar. The moment he inserted the chest tube, air escaped with a hiss. It was a successful decompression. The patient's blood pressure immediately began to stabilize. The medical staff watching were all astonished. Chest tube insertion is a procedure that even experienced doctors perform cautiously, but Kenji did it as if it were a routine procedure. But Kenji didn't stop there. He immediately moved on to examining the abdomen. His abdomen was distended and tender. There was a high possibility of internal bleeding. Bring the fast ultrasound, Kenji instructed. FAST was an ultrasound examination used to quickly assess for internal bleeding in trauma patients. However, this also required considerable experience. Kenji expertly operated the ultrasound probe. He scanned the right upper quadrant, left upper quadrant, and pelvic cavity sequentially. Free fluid was visible in the abdominal cavity. It was definite internal bleeding. Confirmed intra-abdominal bleeding. Prepare for emergency surgery. Kenji's diagnosis was accurate, and his treatment was swift. He also instructed them to prepare for a blood transfusion. Dr. Thompson watched the entire process. He was increasingly unable to hide his astonishment. It was inconceivable for a first-year resident to perfectly manage such a complex multiple trauma patient. Kenji finally assessed the head injury. He checked pupillary response and performed a neurological examination. Fortunately, there were no signs of cerebral hemorrhage. However, a concussion was definite. Once all assessments and treatments were completed, the patient was transferred to the operating room in a stable condition. Thanks to Kenji's swift and accurate judgment, his life was saved. When the emergency room quieted down, all eyes were focused on Kenji. They couldn't believe what had just happened. The quiet Japanese resident had performed expert-level trauma treatment perfectly. Dr. Thompson approached Kenji. Resident Kimura, that was truly amazing. But how did you perform chest tube insertion so skillfully? Kenji hesitated for a moment. It seemed he could no longer completely hide it. I had a little more experience in Japan. The statement was met with silence in the emergency room. But this was just the beginning. Kenji's true story was about to unfold. The emergency room was enveloped in silence. Everyone was shocked by Kenji's confession. The words, "I was already a specialist in Japan," were unbelievable. Then why was he a resident in America? What kind of circumstances led to this? Dr. Thompson was the first to speak. You were a specialist in Japan. Then why are you a resident here? And why did you hide that fact? Kenji lowered his head. He knew he could no longer escape, but it was too painful a memory to talk about everything. There were personal circumstances. Jessica retorted sharply. Personal circumstances? What do you mean? You entered as a resident, hiding your qualifications as a specialist. This is clear fraud. The surrounding medical staff also began to murmur. Jessica had a point. Hiding one's experience as a specialist and entering as a resident could clearly be problematic. However, Dr. Thompson had a different opinion. He had witnessed Kenji's skills firsthand. There were too many aspects that couldn't be explained simply by being a specialist in Japan. Wait, Jessica. Consider the skills resident Kenji just showed. Chest tube insertion, fast ultrasound, advanced CPR. This is not just specialist level. It's a skill that requires considerable experience. Everyone nodded at Dr. Thompson's words. In fact, what Kenji showed far exceeded the general specialist level. Especially the proficiency he displayed in treating trauma patients was something only those who had worked in trauma centers for many years could possess. Resident Kenji, please tell us the truth. I want to know what kind of work you did in Japan. Kenji took out a worn photo from his pocket. The moment he saw the woman smiling brightly in the photo, tears welled up in his eyes. It seemed it was truly time to talk. I was a specialist in emergency medicine in Japan, but it wasn't just that. Kenji's voice trembled. It was not easy to speak the truth he had hidden for so long. I worked with Doctors Without Borders for 5 years. I worked in conflict zones in Africa, the Middle East, and Asia. This time, it was truly shocking. Doctors Without Borders was known as a medical organization that operated in the world's most dangerous regions. Working there for 5 years meant having an unimaginable amount of experience. Dr. Thompson asked in surprise, 5 years with Doctors Without Borders? You mean you were doing medical work on the battlefield? Kenji nodded. I performed surgery in places where bullets flew, like Syria and Afghanistan, and saved patients where bombs exploded. There were days I performed 30 surgeries. The atmosphere in the emergency room completely changed. The secret behind Kenji's astonishing skills was revealed. The skills honed on the battlefield for 5 years explained everything he had shown today. Jessica was also speechless. Coming from Doctors Without Borders was one of the highest honors in the medical field. Such a person could not be arbitrarily condemned. But why are you hiding such a background and working as a resident here? Nurse Emily asked cautiously. Kenji's expression darkened. It was a question about the most painful part. He looked at the photo in his hand again. She was my fiancée. Kenji's voice became even smaller. She was also a doctor. We met while working with Doctors Without Borders. We were working together in Syria, but his voice trailed off. It was too painful a memory. The hospital was bombed. I was outside, but she was in surgery. I couldn't save her. The emergency room fell silent. Everyone could feel Kenji's pain. The suffering of losing a loved one was palpable. Since then, I couldn't work as a doctor anymore. When I saw patients, I remembered her, and when I entered the operating room, the memory of that day returned. Kenji continued, So, I returned to Japan and quit being a doctor. I couldn't do anything for a year, but the last words she said kept echoing in my mind. What did she say? Dr. Thompson asked cautiously. Don't give up being a doctor, she said. Save more people. So I decided to start again. But I wasn't the same person I was before. I came to America with the intention of relearning everything from scratch. Now everything made sense. Why Kenji had been so quiet, why he had tried to hide his skills, and why he always had a sad look in his eyes. Nurse Emily said, wiping away tears, So that's why you were always so quiet. I'm sorry we didn't know. But Jessica still found it difficult to accept. She realized how cruelly she had behaved. Especially the previous sexual harassment incident was unforgivable. Dr. Thompson said, You are truly a remarkable person. I respect that you chose the path of a doctor again, despite experiencing such pain. Kenji shook his head. I'm still not the person I used to be. There are still many times I'm afraid. Afraid of losing a patient. Afraid of failing again. But look at the patients you saved today. Without your skills and experience, they wouldn't have survived. At that moment, a commotion broke out at the entrance of the emergency room. The families of the patients Kenji had treated today had come to visit. The grandson of Ms. Suzuki, the wife of the myocardial infarction patient, the husband of the pregnant woman. They all came to express their gratitude to Kenji. Thanks to you, doctor, my grandmother was saved. I will never forget that if it weren't for you, my wife would have. Kenji's eyes welled up again at the continuous words of gratitude. It was for moments like these that he had become a doctor again. To save more people, as she had said in her last words. Jessica felt ashamed as she watched all this. She realized how prejudiced she had been, how narrow-minded her view of Kenji had been. She tried to approach Kenji, but her feet wouldn't move forward. Dr. Thompson made a decision. Dr. Kimura, from now on, we will officially recognize your background. Someone from Doctors Without Borders is entitled to the highest treatment. But Kenji shook his head. No, I want to remain just a resident. I think I still have a lot to learn, especially how to communicate with patients. I want to relearn that. Everyone was moved by his humility. Despite having sufficient skills and experience, he had not lost his desire to learn. That night, Kenji went up to the hospital roof again, but this time he wasn't alone. Emily, Michael, and several nurses were with him. They deeply respected Kenji. Kenji, from now on, we'll treat you properly. I'm really sorry for not knowing until now. Michael apologized sincerely. Kenji smiled faintly. It was the first genuine smile he had had in a long time. It's okay. Rather, I'm sorry for not being honest from the beginning. The wind blew, rustling his hair. He looked up at the sky and spoke to her in his heart. But it wasn't over yet. Jessica was still struggling to accept the situation, and an even greater trial awaited. Would Kenji be able to completely overcome his past and start a new life? The next morning, the atmosphere in the hospital had completely changed. News of Kenji's true identity had spread, and all medical staff looked at him with respect. Being from Doctors Without Borders was one of the highest honors in the medical field. As Kenji passed by in the hallway, nurses greeted him politely, and other doctors also looked at him with expressions of interest. However, Jessica was different. She hadn't slept all night. The memory of how cruelly she had treated Kenji, especially that insulting sexual harassment remark, kept replaying in her mind. She couldn't bear the thought of saying such things to someone who had lost a loved one and was suffering from trauma with Doctors Without Borders. During the morning briefing, Jessica was unusually quiet. When Kenji reported on his patient, she didn't find fault. Instead, she seemed to avoid him, keeping her gaze down. The other residents also found Jessica's change strange. Kenji noticed Jessica's change but said nothing. He continued to do his work quietly as usual. However, there was a difference from before. He no longer hesitated and was actively trying to communicate with patients. Around 10 a.m., a special patient was brought to the emergency room. It was a 7-year-old Japanese-American girl who had fallen in the park and hit her head. The child was conscious but kept crying, and her parents were extremely anxious. Kenji was assigned as the temporary attending physician, but it was difficult to conduct a proper examination because the child kept crying, especially since the child's mother was trying to comfort her in Japanese, which Michael couldn't understand at all. "Is there anyone who speaks Japanese?" Michael asked with a perplexed expression. parents also showed expressions of relief. Just having a doctor from the same country was a great comfort. Kenji carefully examined the child. While performing neurological tests, he constantly conversed with the child. Instead of rigid medical terms, he explained in gentle words that the child could understand. If your head hurts, can you tell Uncle? Is it here or here? The child trusted Kenji and answered honestly. Fortunately, the examination showed no serious brain damage, but there was a mild concussion. It was a situation that required observation for about a day. Kenji explained the situation to the parents in detail. He not only explained the medical aspects, but also meticulously taught them what to pay attention to at home. The parents expressed their deep gratitude to Kenji. Jessica watched all this unfold. Through Kenji's interactions with the patient and her family, she saw the true form of a doctor. He possessed not only excellent skills, but also a heart that genuinely cared for and worried about his patients. At lunchtime, Jessica mustered the courage to approach Kenji. She had been troubled all morning. She knew she had to apologize, but she didn't know how to start. "Kenji, do you have a moment?" Kenji looked up. He noticed that Jessica's expression was different from usual. "Yes, what is it?" Jessica fiddled with her hands before speaking. "I want to apologize. I'm truly sorry for everything up to now." Kenji was surprised. He had never imagined Jessica would apologize to him. "Everything I said to you was unforgivable, especially that sexual harassment remark." Jessica's voice trembled. She felt truly ashamed and sorry when she recalled what she had done. "Since I learned you were from Doctors Without Borders, I realized how ignorant and prejudiced I was. To say such things to someone suffering from the loss of a loved one." Kenji listened calmly to Jessica. He could feel her genuine regret. "Jessica, it's okay. It's not okay. What I did is absolutely unforgivable. You are a person to be respected, but I was truly the worst." Tears welled up in Jessica's eyes. She had never felt so ashamed in her life. Kenji said gently, "I wasn't honest from the beginning either. I hid my past, so it was understandable that I was misunderstood. No, that's your right. It's natural to want to hide such a painful past, yet Jessica couldn't continue. She realized again how cruel her actions had been. Kenji pondered for a moment. Then he said to Jessica, "Jessica, to be honest, it was really difficult at first. Your words hurt me deeply." Jessica's face turned even paler, but perhaps it was a necessary process for me. It helped me become strong again. Jessica felt even more sorry for Kenji's magnanimity. She realized how cruelly she had treated such a good person. "Kenji, I'm truly sorry. From now on, I'll change, I promise." Kenji smiled faintly. "Thank you. Your feelings are enough." At that moment, another emergency occurred in the emergency room. A construction site fall accident occurred, and a severely injured patient was brought in. There was a suspected spinal cord injury, and it was a dangerous situation. This time, Jessica moved first. "I'll take charge. Kenji, can you help me?" Kenji nodded. The two of them began to treat the patient together. Jessica humbly accepted Kenji's advice, and Kenji generously shared his experience. As the patient's condition stabilized, Jessica expressed her heartfelt gratitude to Kenji. "It would have been really difficult without you. Thank you." The other medical staff who watched this unfold were also moved. They saw Jessica and Kenji becoming true colleagues. In the evening, Jessica visited Kenji separately. She wanted to talk about what she had been thinking about all day. "Kenji, I really want to change. I want to become a true doctor like you." Kenji tilted his head. "Honestly, I've lived my life relying on my background rather than my skills. maturity through Kenji. I want to work in places like Doctors Without Borders, too. I want to help truly difficult patients. What should I do? Kenji was surprised. He hadn't expected Jessica to want to change so seriously. It's really tough. It's dangerous, and you have to give up everything. I don't care. I want to do meaningful work too. I want to help people like you, truly. Kenji felt Jessica's sincerity. He knew she genuinely wanted to change. Then shall we prepare together? I'll help you. Jessica's face brightened. Thank you so much. That night, the two of them stayed up late together. Kenji explained his experiences with Doctors Without Borders in detail, and Jessica listened and learned earnestly. Kenji, thank you so much. Thanks to you, I know what kind of doctor I should be. Kenji was also happy. Jessica, who had been his rival, had now become a true colleague. And most importantly, he was proud that he could help others. However, not everything was over yet. A greater trial awaited, and would Kenji be able to completely overcome his past trauma? A week passed, and the atmosphere in the hospital had completely renewed. The sight of Kenji and Jessica working together moved all the medical staff, and their teamwork was becoming legendary in the emergency room. Especially when difficult cases came in, their combination produced astonishing results. However, there was still something Kenji hadn't fully overcome: entering the operating room. He performed perfectly in the emergency room, but entering the operating room with a patient still terrified him. The memory of that day, the memory of the operating room where he lost his loved one, was still vivid. Tuesday afternoon, a critical emergency patient was brought in. It was a patient with a penetrating abdominal injury from a motorcycle accident, and due to massive bleeding, emergency surgery was immediately required. Kenji finished the initial treatment perfectly, but the surgery team said it would take time to prepare the operating room. Dr. Kimura, would you mind coming up to the operating room to help? The chief of surgery requested of Kenji. It was a result of his skills being recognized. However, Kenji's face turned pale for a moment. Just hearing the words operating room made his heart pound and his hands tremble. The memory of that day flashed back like lightning. The sound of bombing, the collapsing ceiling, and the sight of her he couldn't save. I have to attend to other patients in the emergency room. Kenji awkwardly refused, and the chief of surgery found it strange. With such skills, he should be a great help in the operating room, so why refuse? Jessica noticed the change in Kenji's demeanor. From his unusual behavior, she intuited that there was some deep trauma. I have to attend to a critically ill patient. The patient eventually underwent surgery with only the surgery team, and fortunately, it was successful. But Kenji was gloomy all day. He was ashamed of the fact that he hadn't completely overcome his past yet. Later that night, Kenji went up to the hospital roof alone. It had become a place he visited often. Here, he looked up at the night sky and let out a deep sigh. I'm still scared. At that moment, he heard footsteps from behind. It was Jessica. She had followed him, worried about Kenji's condition. Kenji, are you okay? Kenji turned around. Seeing Jessica's worried expression warmed his heart. Your expression was completely different when we talked about the operating room today. Did something happen? Kenji hesitated for a moment, but he thought that Jessica would understand his pain. I'm still afraid of the operating room. That's where she died. Please talk about it. It's too painful a memory to bear alone. Tears welled up in Kenji's eyes. He slowly began to recount the memory of that day. It was an ordinary day that day, too. I was working at a makeshift hospital in a small village in Syria. She was operating on a young patient in the operating room, and I was attending to newly arrived patients in the emergency room. Kenji's voice began to tremble. Suddenly, the bombing started. At first, the sound was distant, but it gradually got closer. And then, the last bomb hit our hospital. Jessica listened with bated breath. I was in the emergency room, so I was lucky to be saved. But the operating room ceiling collapsed. By the time I rushed there, Kenji couldn't continue. It was too painful a memory. She was trying to protect that young patient until the end. She used her own body to shield the child. The child was saved, but Tears also flowed from Jessica's eyes. She could feel Kenji's pain acutely. Since then, just entering the operating room brings back memories of that day. The sound of the collapsing ceiling, her last moments. It's all so vivid. Kenji clenched his fists tightly. That's why I came to America. I thought I could start over in a new place. But still, just entering the operating room makes my legs tremble. Jessica held Kenji's hand. Kenji, it must have been so painful to bear the trauma alone. She must have been proud of you too. Do you really think so? Of course. She must have told you not to give up, to save more people. That's what doctors do. Kenji nodded. Jessica's words were indeed true. She was always a person who prioritized patients. You can do it, Kenji. You're strong enough now. Kenji took a deep breath again. At that moment, Kenji's pager beeped. It was an emergency. A large-scale fire accident had occurred, and multiple patients were being brought in. The two of them rushed to the emergency room. Several severely burned patients had already arrived, and the situation looked dire. One of them was a severely burned patient who required immediate surgery. However, a problem arose. The hospital's chief surgeon was in another emergency surgery and couldn't respond immediately. Dr. Kimura, why don't you go ahead and try? A nurse suggested. Everyone knew Kenji's skills, but this was something that had to be done in the operating room. Kenji's face turned pale again. He knew the patient was in danger and he should go, but he was still terrified. Jessica looked at Kenji. She could read his internal conflict. Kenji, you can do it. I'll come with you. Kenji looked at Jessica. He felt conviction and support in her gaze. But what if I'm not okay during the surgery? I'm right next to you, and she's with you too. Jessica's words gave Kenji a little courage. It was a matter of the patient's life, and this was what she had hoped for. Understood. I'll try. As Kenji made up his mind, Jessica smiled. Okay, let's go together. On the way to the operating room, Kenji's steps became heavier. As they approached the operating room door, the memories of that day became even more vivid. But having Jessica next to him provided some comfort. In front of the operating room door, Kenji paused for a moment. His hands were trembling, and his breathing became rapid. Are you okay? Jessica asked with concern. Kenji took a deep breath. Then he took out her photo from his pocket. Sorry. Please wait a little longer. This time I'll really try. He put the photo back in his pocket and opened the operating room door. Would Kenji overcome his trauma and successfully complete the surgery? The moment the operating room door opened, Kenji's whole body broke out in goosebumps. The white lights, the patient lying on the operating table, the sounds of various medical equipment. Everything brought back memories of that day. It was too similar to the operating room in Syria. Kenji's legs faltered, his chest felt tight, and his breathing became ragged. The sound of bombing seemed to echo in his mind, and the image of the collapsing ceiling flickered before his eyes. Kenji, are you okay? Jessica grabbed his arm. I can't. I'm sorry. At that moment, a nurse shouted urgently. The patient's blood pressure is dropping. We need to operate quickly. Kenji looked at the patient. It was a man in his 40s with severe burns, hovering on the brink of death, unconscious. He knew his family was waiting outside the operating room. I have to do it, Kenji said with a trembling voice. But the moment he reached for the surgical gown, the memories of that day flashed back like lightning. The bloody surgical gown she wore that last day, and the sensation of her cold hand. Kenji almost sat down, but Jessica firmly supported him. Kenji, look at me. This isn't Syria. This is a safe place, and I'm here too. Jessica's voice gradually calmed Kenji. He took a deep breath slowly. Jessica looked into Kenji's eyes and said, "She must have told you to save patients, right? That's what doctors do." Kenji nodded. It was as Jessica said. She was always a person who prioritized patients above all else. "You can do it, Kenji. You've become strong enough now." Kenji took another deep breath. Then he began to put on the surgical gown. His hands were still trembling, but his heart gradually stabilized. The surgery began. At first, Kenji's hands were more cautious than usual. His hand holding the scalpel trembled slightly, and his concentration was not perfect. Jessica encouraged him and assisted him throughout. "Let's start by removing the burned tissue," Kenji said. However, the burn site was more severe than expected. Not only the skin, but also the muscles were damaged. A more complex surgery was needed, and it seemed it would take a considerable amount of time. As the surgery progressed, Kenji gradually began to regain his true skills. The know-how he had gained with Doctors Without Borders resurfaced one by one, and his hands began to stabilize. "Let's start with vascular repair." Kenji's voice regained its confidence. Jessica watched Kenji's transformation and was moved. She could see him gradually overcoming his trauma. Midway through the surgery, an unexpected problem arose. The patient's blood pressure dropped rapidly, and he went into cardiac arrest. The operating room was filled with tension. "Start CPR," Kenji responded immediately. But at that moment, the memories of that day flooded Kenji's mind again. She had also gone into cardiac arrest, and the helplessness he felt then washed over him again. Kenji's hands began to tremble again. Even while performing CPR, his concentration wavered. "Kenji, focus," Jessica shouted. But Kenji was confused between the past and the present. The patient's face overlapped with hers, and the operating room lights felt like the flashes of bombs. "No, I can't lose him again," Kenji murmured. At that moment, Jessica grabbed Kenji's shoulder and shook him. "Kenji, snap out of it. You can save this patient now." Jessica's shout pulled Kenji back to reality. He realized where he was and what he had to do. Kenji refocused on CPR. This time, he performed it perfectly, without wavering. His experience and skills began to shine. 3 minutes later, the patient's heart began to beat again. A sigh of relief swept through the operating room. Blood pressure stabilized. A nurse shouted. Kenji paused for a moment and took a deep breath. He couldn't believe what he had accomplished, and most importantly, he realized he was no longer overwhelmed by the memories of that day. Resuming the surgery, Kenji had completely transformed. No longer bound by the past, he focused solely on the current patient. His hands were precise, and his judgment was swift. "Prepare for dressing." Kenji's instructions were full of confidence. Jessica also perfectly matched his breathing and assisted him. The two of them had perfect teamwork. When the long surgery, which lasted 4 hours, ended, Kenji finally felt that he had overcome his past. The operating room was no longer scary, and the memories of her, no longer painful, now brought warm feelings to his heart. "Surgery complete," Kenji said with a final exhale. The patient's family, who had been waiting outside the operating room, looked at Kenji and shed tears. "Doctor, thank you so much. Thank you for saving my father." Tears welled up in Kenji's eyes, too. It was for moments like these that he had become a doctor again. As they left the operating room, Jessica said to Kenji, "That was truly amazing. You've completely changed." Kenji nodded. "Yes, I think I've finally overcome it. She would be proud too." That night, Kenji went up to the hospital roof again, but this time he wasn't alone. Jessica, Michael, Emily, and many other colleagues were with him. "Kenji, congratulations. You did it." Everyone encouraged him. Kenji took out her photo from his pocket one last time. The woman in the photo was still smiling brightly. "Thank you. Thanks to you, I was able to start again. Now I can save many people." The wind blew, gently rustling the photo. It was as if she were answering him. Kenji hugged the photo to his chest and laughed with his colleagues. He now had a new family and a new dream. 3 months later, Kenji and Jessica submitted their applications to Doctors Without Borders together. Jessica had decided to give up everything to become a true doctor like Kenji. "Are you really going together?" Kenji asked. "Of course. I want to put into practice what I've learned from you." Jessica smiled brightly. Dr. Thompson initially tried to dissuade them, but ultimately respected their decision. "I'm truly proud. It gives me hope to have doctors like you." On Kenji's last day, all the staff in the emergency room saw him off. His presence there had deeply touched everyone. "Come back anytime, Kenji," Emily said, wiping away tears. As Kenji left the hospital, he looked back. Here, he had been reborn and started anew as a true doctor. And most importantly, he was now able to fulfill the last wish of his loved one. "I'm going to save more people," Kenji murmured to himself, looking up at the sky. The sunlight filtering through the clouds seemed like her smile. 6 months later, in a small African village, Kenji and Jessica were treating patients together. Jessica, as Kenji had taught her, truly empathized with her patients. And Kenji, no longer bound by the past, was faithful to the present. One evening, Kenji was gazing at the stars outside the tent. Jessica approached and sat beside him. "Do you regret it?" Jessica asked. Kenji smiled. "Not at all. This is what I should be doing. She would be proud too, wouldn't she?" "Yes." Just then, they received word of an emergency. The two of them quickly got up and went to meet the patient. Kenji's steps were full of confidence, and there was no longer any fear. "Let me see if your hands are good ones, and if they are, I'll even get pregnant for you." Those insulting words Jessica had spoken then now had a completely different meaning. Kenji, having become a true doctor, was truly saving countless lives, and in the process, he had gained true love and friendship. The story, which began amidst prejudice and discrimination, now became a message of hope and courage. It ended as an inspiring story that teaches not to judge people by their appearance, and that even wounded hearts can rise again. Kenji's true life was just beginning. Having overcome the pain of losing a loved one, he was now inspiring more people. And her last words always lived on in his heart. "Don't give up being a doctor. Save more people." Kenji was keeping that promise, and he would continue to keep it. Thank you for watching this long video today. By subscribing